Hello, everybody. It is very honored for me to be here with you. So, it was 2007. I shows one slide. This is a certificate of educational experience of is a Riordan clinic. And I visited the Riordan clinic for the training, 2 days training for an IVC for cancer treatment. Because this is a first experience to visit the Riordan clinic and finish the training and shaking hands with Dr. Long and also is James Jackson. And this shaking hands is the beginning of my journey to the IVC therapy for cancer treatment. Before the beginning of my presentation, I would like to announce the next year 46th Annual International Conference of Osmolecular Medicine today in from April 20 to 30, 2017 in Toronto, Canada. This is a terrific international conference of osmolecular medicine. And speaker is very great, and Dr. John Hoffer, and Dr. Prowski, Dr. Eileen Barford Mason, and James Greenblatt, and Ron Hanihaki, and also some Phyllis Bronson, and some are being here with us. And please visit isom.ca, and you can find how to register this conference. Also, you can access to the journal of free. Today's topics is, I have 3 topics. One is radiation sickness and vitamin C, and osmolecular treatment for patients with HPV vaccine side effects, and IVC network in Japan. Now start with the first topics. As all you know, March 11, 2011, huge earthquake and tsunami attacked the Pacific coast of Japan. 2,000 people were killed, and still 2,000 missing. One day after the earthquake and tsunami, Fukushima nuclear power plant accident occurred. One unfortunate consequence of this event has been the environmental disaster caused by the release of radiation from the Fukushima nuclear power plant. We have to consider about the radiation exposure from air, water, and contaminated food chain. Radiation exposure affect our health and cause many diseases, including cancer, heart diseases, birth defect, etc. At first, I'd like to explain the mechanism of radiation-induced cellular injuries. Most of the people believe that radiation directly hits the DNA. But it is true, but not untrue. There are 2 routes of radiation injury, direct and indirect route. Radiation can strike the DNA molecule directly to the DNA and damage it. This is a direct route. Most people believe that this direct route is the only one cause of radiation damage on DNA. This direct cause of the radiation injury is only 20%, whereas other 80% is. Other 80% of radiation injuries caused by indirect route. Radiation hits and ionized water molecules, producing free radicals that react to damaged DNA molecule. This is a key point and a very important part. So you can imagine indirect route is due to free radicals, and free radicals can be neutralized antioxidant like vitamin C. There are many scientific studies demonstrating protective effects of vitamin C and other antioxidative nutrients upon radiation injuries. In 2010, 1 year before the Fukushima nuclear power plant accident, one paper published entitled "Pretreatment with ascorbic acid prevents lethal gastrointestinal syndrome in mice receiving a massive amount of radiation from National Defense Medical College and Ground Self-Defense Force in Japan." They gave the vitamin C 150 milligram per kilogram per day, orally administered to mice and to continue for 3 days. These mice underwent high radiation exposure. So pretreatment with ascorbic acid markedly improved the survival rate. Authors of National Defense Medical College of Ground Self-Defense Force in Japan commented in this article, "When we undertake the rescue of victims from the radiation-contaminated area just after a radiation accident or terrorism, it is important for rescue team members to promptly take vitamin C orally." This paper was published just 1 year before the Fukushima nuclear power plant accident. So Japanese rescue team went to the contaminated area of the Fukushima nuclear power plant. So did the rescue team took vitamin C at Fukushima in March 2011? Answer is yes. They are a good choice. But this information does not distribute to the Fukushima workers and to the people living in the Fukushima contaminated area. We got this article, and Japanese College of IV Therapy, my association, issued an official statement about environmental radioactivity and health issue in March 29, 2011, 16 days, 2 weeks after the accident. Our working group is me and Long and Dr. Hanehaki and Thomas Levy, and other Bradford Weeks, Stephen Hickey, and Barton Bergson, etc. So it is our strongest recommendation that those living in the affected areas regularly take antioxidant supplements such as vitamin C to counteract the negative consequence of long-term low-dose radiation exposure, as well as to protect the health of coming generations. This statement we distribute to the press release, and government, and also newspapers and TV and everywhere. But one day after, no phone call coming. Government and media ignored about our issues. Our recommendation is people who have a possible internal and external radiation exposure should take antioxidative supplements to maintain optimal antioxidative reserve on their own body. Vitamin C, we 1 to 3 grams 3 to 4 times a day, and also lipoic acid, selenium, and vitamin E. Japanese government, Tokyo Electric Power Company, TIPCO, and media ignored our proposal. 1 month after our issues, I presented our proposal statement at the conference of the International Society for Oncology Medicine in Toronto. It is happy for us because board committee of this association write a letter with a signature of attendees to the government. And they support our statement. But still, government ignored our statement. So we need some as evidence of the effectiveness of vitamin C on radiation exposures. We conducted a study of vitamin C and whether the vitamin C can prevent radiation damage or not. And we got good results from Fukushima nuclear power plant workers. And this study was published in the osmotic treatment of chronic disease, edited by Dr. Atsuo. This is very helpful for us in Japan. So study subject is 12 men who worked 5 to 6 weeks at a radiation-contaminated area of Fukushima nuclear power plant after March 12, 2011. Their working operations at the contaminated area is collecting contaminated water, measuring radiation level in the plant area, removal of debris of the radiation, and operation of heavy machineries. We measured plasma-free DNA and also measures gene expression of the cancer risk. We calculated cancer risk score. And 2 of 12 men has abnormal elevated value of the plasma-free DNA, and 3 of them has abnormal value of cancer risk scores. So we have some intervention to these 5 workers. Intervention is intravenous vitamin C, 25 grams once every 2 weeks, and daily oral supplements of liposomal vitamin C, lipoic acid, selenium, vitamin, and multivitamins. Free DNA decreased normal base in all workers. And also 3 of them decreased the normal base. 1 worker does not decrease to the normal levels. He went to Fukushima nuclear power plant again during these 2 months period, and then back to the Tokyo and started our program. And 1 month later, he returned to the normal levels. So in conclusions, working at the Fukushima contaminated area has a risk of radiation-induced cancer. Those cancer risks can be neutralized by antioxidative nutrition. We strongly recommend that people living in the radiation-contaminated area should take vitamin C immediately. We JCIT working group believe that vitamin C can save the people's life from radiations. However, we continuously release a press release, but government, TEPCO, and media still ignored our proposal. And at this time, Fukushima workers have not taken vitamin C. Recently, shocking paper was published, Thyroid Cancer Detection by Ultrasound among residents ages 18 years and younger in Fukushima, Japan, 2011 to 2014, published in Epidemiology from Okayama University, Japan. Among those ages 18 years and younger in 2011 in Fukushima Prefecture, approximately 30-fold excesses in external comparisons and variability in internal comparisons on thyroid cancer detection was observed in Fukushima Prefecture within as few as 4 years after the Fukushima power plant accident. So, government does not comment this article published in this May. Radiation, also media does not report of these articles. Radiation-related health problems such as cancer, heart diseases, birth defects, etc. will increase in the next 5 to 20 years or more in Japan. The incidence of thyroid cancer is increased among young people who have lived in Fukushima area. We believe the daily intake of vitamin C, 3 to 6 grams, can prevent radiation-induced health problems and keep optimal health. According to the experience of Fukushima nuclear power plant accident, we human beings cannot control nuclear power. Once nuclear power plant accident occurs, radiation harms people's health and make the earth more sick for thousands of years. And this may happen everywhere in the world. Japan has more than 57 nuclear power plants, and now only 3 plants start to supply electricity. However, government and TEPCO rerunning all nuclear power plants politically. So they say nuclear power plant is safe and cheap. Nuclear power plant is built up. They need much water, and they built up in very close to the lake or Pacific, very close to the sea. All 57 nuclear plants in Japan was built up in the coast. And as you know, Japan has lots of many earthquakes. I think nuclear power plant is dangerous and expensive. My opinion, as a physician who care people's health and life, we should stop all nuclear power plants on the earth. That is my opinion. Thank you very much. So government should listen our opinion or to listen your. So second topic is osmolar care treatment for girls with HPV vaccine side effects. As all you know, the immunization of girls between 12 to 19 years with a human papillomavirus HPV vaccine was initiated to prevent cervical cancer. The HPV vaccine Gardasil, Merck and Dome was approved in 2006, and Cervarix GlaxoSmithKline was introduced in 2009. However, more than 1,500 serious side effects were reported in Japan, and standard therapy could not cure those girls. In 2013, the government task force analyzed the reports of HPV vaccine injuries, examined 2,500 cases, and found 25% cases to be serious. However, another health experts, private experts, re-evaluated those cases and judged 44% cases as serious. However, Japanese government healthcare committee commented that adverse reactions are the psychosomatic reactions. I show the movie. This is the first patient I experienced. She's a 17 years old high school girl, and 2 years before, she took the Cervarix vaccine. And 3 months later, she has a convulsion, involuntary movement, and headache, joint pain, muscle pain, and menopause, and lots of symptoms occurred. HPV vaccine adverse effects is lots of various symptoms: headache, general malaise, muscle weakness, nausea, difficulty with awakening, learning disturbance, muscle pain, dizziness, photophobia, arm, foot, finger tremor, joint pain, abdominal pain, etc. The big problem issue is onset of initial symptoms, side effects, occur after HPV vaccine, average of 9 months. That means girls and mother does not realize those symptoms is come from HPV vaccine side effects. The cause of this side effect, there's many reasons cause. One is aluminum adjuvant. HPV vaccine contains amorphous aluminum hydroxyphosphate sulfate as a powerful adjuvant. Powerful adjuvant means to boost the immunity and sometimes have lots of immune side effects. Current research strongly implicates aluminum adjuvants in various inflammatory, neurological, and autoimmune disorders in both humans and animals. Once vaccine injected in the muscle, macrophage coming to and phagocytes the aluminum and bring to the various organs and looks the brain, and macrophage carries aluminum to the brain is more than 3 months. That's the reason why such side effects, adverse effects occurred very late onset. 4 months ago, Shinshu University scientists showed the experiment results. So there are 3 types of vaccine: influenza and hepatitis and HIV vaccine, inject to the mice, and 6 months later, autoimmune vaccine antibody was deposited in hippocampus, only seen in the HPV vaccine-treated rats. So this is still the cause of this side effect is unknown, but autoimmune disease like inflammation occurred in the brain. I am practitioners, and I would like to treat the patient and try to treat, because such girls visited university hospitals, but doctor said, you should go to psychiatric department. And psychiatric department cannot treat them. And so I try to treat vitamin C and glutathione. I call it a VCG cocktail using the vitamin C, start at 12.5 grams and increase. Some girls use 37.5 grams, and glutathione 800, start at 800 milligrams, and magnesium, and also calcium gluconate and vitamin B complex. I show the videos in the first patient, and this is a patient also brain perfusion imaging. This is before the treatment, 4 months before the treatment, and this is a defect of the perfusions. So this is not psychosomatic, this is an organic diseases. And after 2 months after the VCG treatment, and the perfusion is improving, and we have the 2015 improving more perfusions. This is another case when she visited my clinic, and there's a it looks like a Parkinson's tremors. And she cannot walk because she's in wheelchairs. And left is before treatment, and right is immediately after the treatment. So vitamin C and glutathione works. But I believe, and unfortunately, this is not the perfect treatment. I also is multivitamins, EPA, DHA, and vitamin D, magnesium, vitamin C orally, and some and MTHF, and probiotics, and turmeric, and lipoic acid. We mix and discuss with Dr. Klaus Hanke, is also Molecular Association president in Denmark. Regarding HPV vaccine adverse effects, symptoms and the timing of appearance vary by each patient. These symptoms are different from anything that we have experienced before as a physician. Unfortunately, the government and the medical societies have not faced the problem proactively. It is funny things. Japanese Association of Gynecology and Obstetrics announced to the public to do to the public the use is so the HPV vaccine is safe and children, girls should be taken. But this April, National Osaka University Department of Obstetrics and Gynecology reported that they investigate and questionnaire to send the doctors of the gynecologist who has girls. And there are 55 girls not unvaccinated. and asked doctors, the question is, do you administer HPV vaccine to your daughter? Yes or no? Yes is 0%, and no is 100%. So that means, and also, second question is, do you recommend the HPV vaccine to the girls, not your daughter, the girls? 60% doctors, yes. So physician, as a doctors of obstetrics and gynecologists, does not inject the HPV vaccine to their daughters, but some doctors inject the patient. However, as the Japanese Society of Gynecology and Gynecology and Obstetrics recommended HPV vaccine. It's crazy, I believe. So effectiveness of osmolarity treatment is variable. Some are very effective and some are not. In order to establish an effective protocol, medical scientists and clinicians have to work together. The onset of HPV vaccine adverse effects comes several months or even more than 1 year after the injection. This delay makes it very difficult to link the symptom with HPV vaccine. In Japan, more than 1,200 girls were registered as severe, and still new patients were registered every day. Last week, one girl comes to my clinic and have lots of symptoms of HPV vaccine. But girls and also mother did not realize that is caused from the vaccine side effects. We estimate more than 300,000 unrecognized girls with mild to moderate HPV adverse effect. The symptoms are commonly seen in young schoolgirls as fatigue, muscle pain, headache, learning disturbance, difficulty in awakening, hypersomnia, irregular menstruation, etc. So, in my personal opinion, as an osmolarity physician who care people's health, we should temporarily discontinue HPV vaccine, is my opinion. Thank you. Now move to the third topics of IVC Network in Japan. Japanese College of Intravenous Therapy was founded in 2007. And this is mark, is the logo mark, is Japanese College of Intravenous Therapies. This is Asia, and this is North and South Americas. And Pacific Ocean, the dolphin is jumping. We invited many speakers, expert speakers, Long and Dr. Levy and Dr. Barton Baxons, and also from Korean associations. We have 20 seminars every year. 20 seminars, educational seminars. This is JCIT board members in 2016, and below is international board member, Long, and Tom Levy, and Roberta, and Dr. Atsuo, and Dr. Liu from Taiwan, Neil Riordan, always being here with us. They're very helpful for learning for Japanese. JCIT established in 2007, and I am president. And now, at this morning, I checked some numbers, 706 members practicing IV therapy using Riordan IVC protocol. This is, they paid annual fee. Our mission is contribute to the people's health by creating a society where everyone can choose to get safe and effective osmotic IV therapies. And main activity is educating the doctors and the society. There's lots of many variety of the IV therapy in Japan, including ozone therapies. And this is Newsweek published in the last month in September. Its front page is not so good. Trump's this is Japanese image. His Black History of Trump. And so this is big topics. Is cancer, and 2-page has of the interview of myself, and I introduce a minimally invasive treatment for cancer. So, thank you. I was very happy for me. Thank you very much. You are too kind. The facts about members. We have now the 700 doctors, and including physicians, dentists, and a few veterinarians in 2016, and members increasing year by year, and covering all prefectures in Japan. So we have the IVC Network. IVC Network, we have two good things. One is we can do the clinical studies. The other thing is networking, exchange doctors and knowledge and everything. So before coming to this conference, we surveyed the doctors' choice on their own cancer treatment in Japan 2016. We investigated the beginning of September. From the survey of 339 doctors in Japan. The purpose is, I'm sorry, this is too new and not in the year syllabus. So most of the patients who are diagnosed with cancer must choose from limited options of standard therapy suggested by the oncologist. Among standard therapy options, chemo has a strong adverse reactions and drastically lower quality of life. Sometimes it is difficult for the patients to make decisions because chemo often fails to improve conditions, or cancer can recur even if the treatment works. Therefore, we conducted a survey on doctors who have rich knowledge of medicine about choice they would make if they were diagnosed cancer. Method is we sent an email to 650 members of the JCIT and asked to fill out a questionnaire built on the web. We also asked the members to look for non-member fellows of physician dentists who replied the same questionnaires on the web. Medical doctor physician is 71% and dental dentist is 28%. Male 75% and female 75 and 25. So I pick us a few questions and answer. Assuming that you are diagnosed with cancer and have to select chemo, which of the following item would you give high priority to? Choose 1 to 3 items. Severity of adverse reactions, 77%. Response rate, 67. Extension of survival periods, 56. And probability of complete emission, 47. It is very, very strange because in general, people, if you have the sickness, response rate should be the fast. But it's amazing. Severity of adverse reaction is the first priority for selecting the chemo. No such diseases and treatment in the field, only the cancer. So doctors very afraid about the chemo adverse reactions. Would you undergo chemotherapy if you were diagnosed with cancer for which radical surgery is not possible and chemo is the only treatment options? I would 50%. I probably would 42%. So 57% choose a chemo. And I probably would not 30%. I would not 13%. So 43% is not choose a chemo. I'm not sure this number is how about in the United States. Anyways, some doctors believe the chemo and some are not. But oncologists always recommend chemotherapy, and they do not choose no chemo in Japan. Would you undergo non-standard therapy if you were diagnosed with cancer? Standard therapy is surgery, radiation, and chemo. I would, and I probably would, is 89%, and not is 11%. Okay, it's 90% of the physicians and dentists, they choose another option of the treatment. So high dose IVC therapy, IVC treatment is 68%, is the number one. And JCIT members 72%, other doctors 60%. And immunotherapy is 50%, nutrition supplements 42%, and dietary therapy 29%, and hypothermia 25%. And 100% of the doctors choose one of the 1 to 5 these treatments. In conclusions, for the patients, oncologists should show not only treatment with chemo, but also therapeutic option without chemotherapy. Moreover, oncologists also should show the patients non-standard therapies such as IVC, immunotherapy, osmotic neutron therapy, etc. So back to the IVC network in Japan. We 700 members, it's good communication is in the web. And if the patients if his patients travel to the Hokkaido or Kyoto or Okinawa, we can introduce and refer to our members of the Hokkaido and other areas. So patients can travel everywhere in Japan. Sometimes patients cross a board. So we need worldwide IVC network, as Ron told us. So let us work together to establish a worldwide IVC network in this world and make a better, healthier, and safer place, one country at a time. This is the final slide. We are 10th anniversary. This year is our 10th year anniversary of the JCIT. As a president, I have to show our members the direction is the next 10 years. And this is the slogan of our association, is next 10 years, New Age Medicine. New Age medicine, New Age is very old, about the 1960s, sometimes, but however, for young doctors, this New Age medicine is very new word. We are old. I know New Age means sometimes very, hippie. But it wasn't, 50 years ago. This was now make new. New Age medicine means we are free from government. We are free from conventional medical associations, and we are free from drug company. We are treating patients, patient-centered, and listen to the patient talk and sitting together, and the user treatment for non-harmful treatments, nutrition first, IVC therapy, and also medicine treatment. I think this is New Age medicine in 21st centuries. Thank you very much.